I'm Jordan, a level 1 nursing student. Can I get your SBAR report?
Sure. We have Shanae O'Connor. She's a 34-year-old female in room 231. She has a full code. Her allergies are to trimethoprim, sulfamethoxazole. She's a patient of Dr. Engelbert's. She came in with a fever of undetermined origin. She does have end-stage renal disease. She complains of fever, chills, malaise. She's a type 1 diabetic. She's had elevated blood glucose levels and a decreased appetite for the past few days with minimal urine output. She has a history of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She is undergoing hemodialysis 3 times a week for 1 year. She is listed for transplant 6 months ago. She did have a graft infection 3 months ago, resolved after antibiotics. She has a history of recurrent UTIs. The AV graft is in the left forearm. She has no tenderness, drainage. Skin is intact otherwise. She is alert and oriented ×3. No acute distress, appears a little uncomfortable. She does report tingling and numbness in her lower legs, and she does have diminished sensation. She denies any shortness of breath. She quit smoking 2 years ago. Her chest expansion is symmetrical with clear lung sounds. She has tachycardic regular rhythm, S1 and S2 present. She has slight 1+ non-pitting edema in the lower extremities, 1+ pedal pulses in both feet, and her cap refill is less than 4 seconds. Her abdomen is soft, round, non-tender. Bowel sounds are present ×4. She does report the weight gain of 10 pounds over the past few weeks with the decreased appetite and decreased intake. She has no pain or complications with her bowel habits. She is on the renal diet, 1,500 milliliters with a daily fluid restriction. She reports decreased frequency and volume of the urine. It has been more concentrated and darker in color. However, she denies any pain, burning, or difficulty with the urination. Her activity is as tolerated. We'll be monitoring I's and O's and notifying the physician if the temperature is greater than 101. Her blood pressure is 180/100. She does get daily weights, and she's on a sliding scale insulin with checks before meals and at bedtime. Her last vital signs were 101.1 temp, 95 heart rate. She is setting at 96%, and her blood pressure is 138/78. Her last blood glucose was 155 at 7:30. Her CBC is pending. Her comprehensive metabolic panel is pending. Her culture and sensitivity is pending, but her urinalysis does show increased white blood cells. She will be going for dialysis. She has the right median vein, and today we're going to start IV antibiotics, the imipenem with the cilastatin and the sodium chloride at 0.9%.
I have a few questions.
Okay.
Why specifically is this client receiving this medication, and what action does the medication have on the body?
The client is showing white blood cells in the urinalysis, which is a sign of infection. So we're giving the imipenem as a broad spectrum bacteriocide until the culture and sensitivity results are back. The imipenem binds to the bacterial cell wall, resulting in cell death, and it's in combination with the cilastatin that prevents renal inactivation of the imipenem.
When should you question administering this medication? Does the medication have a therapeutic serum level? Which vital signs must be monitored, and which physiological parameters should be monitored when the medication is being administered?
Okay. We'll question if she has any hypersensitivity and the renal impairment. If the dialysis was not scheduled within the 48 hours, I'd question administering the imipenem to her since she has the end-stage renal disease. And also patients with a creatinine clearance of less than 20 milliliters per minute are at risk for increased seizures. We'll monitor all vital signs, but especially the temperature, blood pressure, pain, and heart rate. We'll monitor I's and O's. We'll assess her urine concentration and color. We'll check for any signs of anaphylaxis, such as rash or laryngeal edema. We'll monitor labs, her BUN, AST, LT, creatinine, hemoglobin, and hematocrit.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
We'll advise the patient to report any signs of superinfection, like a black furry overgrowth on the tongue, loose or foul smelling stools, and any signs of allergy. We would have her contact the provider if a fever and diarrhea occur, or if the stool contains any blood, pus, or mucus. We'll advise her not to treat the diarrhea without consulting a physician first.
What are the side effects and potential adverse reactions?
Side effects include seizures, dizziness, hypotension, C. diff-associated diarrhea, nausea, vomiting, rash, pruritus, urticaria, phlebitis at the IV site, and of course anaphylaxis and superinfection.
How will you know the medication is effective?
When the signs and symptoms of infection have resolved.
Okay.
Okie dokie. So we're going to pull the meds here. So she's getting the imipenem with cilistatin and the sodium chloride at 0.9%. So I'm double checking my bags with what is ordered. So we have the cilistatin and the sodium chloride. When I'm filling them, I'm checking for color clarity and for any holes in the bags. So we'll go ahead into the patient.
Okay, well, we want to make sure that she calls us if she's having any pain in the site. If she wants to go move around, we need to make
Hi, my name's Andrea. I'm going to be your nurse today.
Hi,
May I have your full name and date of birth, please?
I'm Shanae O'Connor and I'm 34 years old.
Okay. And do you have any allergies?
Yes, trimethoprim and sulfamethoxazole.
Nice job.
we also want to make sure that she knows that taking antibiotics and making sure that
Okay, so I am here today to administer your antibiotic. Do you know why you are receiving this antibiotic?
I have an infection.
Yep. You're showing white blood cells in your urine. So we are going to be giving imipenem. You do have the right to refuse this. Do you refuse the medication?
No.
Are you aware of any signs or symptoms, any side effects that you should be looking for while receiving this medication?
A rash?
Yep, any type of allergic reaction like a rash, or if you have any breathing problems, increased heart rate, any dizziness, put on your call light. I did print out some information for you with some more specifics about the antibiotic.
Thanks.
Sabrina, I'll be your nurse. I'm gonna
Okay.
saline.
So,
And also
since we're administering this IV, I'm going to first make sure that your IV site is patent.
And can you give me your name and date of birth?
I don't see any redness or swelling.
Great. Do you have any allergies? I see it in an allergy band.
Okay. Is this burning at all?
Nope.
All right, awesome.
That's a mouthful.
So the IV site
Okay.
is
And what
patent.
happens when
I will leave that
you
attached.
have a reaction to that? Like a rash.
Okay. So again, I have my medications here. I'm going to hang the sodium chloride first, double checking the bag with the MAR. So I have the right patient, Shanae O'Connor, the right medication, sodium chloride at 0.9%, normal saline,
So first, when we're gonna, kind of
the right dose,
or anything like that, we want to check the patency
and the right
we wanna
route.
check the AEAD site and make sure it's okay. So what we're gonna be looking for is any signs of redness, any swelling, any warmth, or any pain.
I'm going to scan the client's armband.
That'll be the first thing we're gonna do. And then we'll flush the site. We wanna make sure that when we do this,
And scan the medication.
So are you aware of the side effects of this drug?
I recognize
Yeah, you can. Nausea, vomiting.
There we go. We're green.
Breath, or if you have a rash starts to show up or anything like that.
spike the bag. And we'll prime the tubing here. Make sure there are no kinks.
To make sure that you take particular care of your mouth and let us know if there's any signs of any brush or sores in the mouth.
And we're primed. Checking for any air bubbles. Looks good.
Remove your tubing from the bag and make sure that you clean it immediately.
So we'll go ahead and turn on
This is a clean slate.
the system.
Alright. So first we're going to go ahead and get your normal saline fluid. Okay. So you always want to let the patient know that they have a right to refuse.
Gonna
So
hook it up
that
to
they don't want something
still
to affect it,
sterile.
right? You also want to ensure that it is the right
Okay.
medication.
So channel select, guardrail IV fluids, 0.9% normal saline.
Patient.
Correct, yes.
You are administering them
And the rate, double checking, 30 milliliters per hour.
both of these bags.
Volume to be infused. We're going to set it for 950 so the line does not run dry.
Fluid is clear.
Making sure we're unclamped.
So, alright,
And watching for my 5 drops.
okay, so that's you.
In the meanwhile, I'll go ahead and
This is
tag the IV line with my initials, date, and time. Okay.
And make sure the time is correct. It's the correct dosage. Good to go. Alright.
So signing the MAR that was given, and now we'll start the imipenem. So again, double checking my bag with the MAR, imipenem psilocybin. Scan the armband of the patient.
I'm gonna go ahead and use lower. If I wasn't, then it would be a primary bag. I just have to
Go ahead and scan the bag.
So that's you. And you're gonna wanna squeeze the chamber, fill it till it's about halfway.
Checking expiration date on both of the bags. Oh, I might have done that, but double checking. So go ahead and spike. And prime the tubing.
I made sure that it was primed. And then no bubbles in it. No bubbles, your machine.
And the line is primed, no air bubbles. So I'm going to lower the normal saline. Hang the imipenem.
No bubbles. Now we're good.
Go ahead and clean. Okay.
I'm gonna leave the top on this.
And then I'm
just in
going
case.
to set up my secondary. So channel select,
What we're gonna do is
secondary.
patient,
I'm gonna go down to the imipenem psilocybin. It's the 500 milligrams and 100 milliliters. Double checking
the bag. Yes, that is correct. Next, the duration is going to be 1 hour. Hit start, make sure it's unclamped, and watching for my 5 drops.
Infused at 30 mils an hour.
Okay. I'll go ahead and tag the line. Put my date, time, and initials.
Yeah, I should be. Especially because this is medication, so we're gonna wanna always double check that this is the correct medication for the client. So you're gonna need to tell me again, what's your name and date of birth? Okay. And that's good. And this is the right patient, and this is the right medication. And it's the right time.
Okay, so sign the MAR. Okay. Do you have any questions for me?
Nope.
Great. So you have your call light. That
Yep.
is down. If you need anything, press the call light.
Okay.
Okay. What's your name and date of birth again?
I have a few questions.
Okay.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I reviewed the 5 rights, the patient, dose, time, and route. I reviewed the allergies with the client and double-checked for the Y compatibility between the imipenem and the normal saline.
Did this information affect your decision to administer the medication?
It allowed me to administer the medication appropriately and accurately by confirming that all of that information was correct.
Did this information affect how you administered the medication?
Confirming the Y-site compatibility and paint and IV allowed me to hang the bags and IV infuse the medication.
Okay.